Good day everyone! For this video, we are going to talk about ADHD. So sit back and listen to our discussion.
Hi, I'm Marian Rosario and let me talk about you the background of ADHD. According to American Psychiatric Association, ADHD or Attention Deficit Hyperactivity Disorder is one of the most common disorder among children, although even adults may have it too. ADHD is a condition that makes it difficult to children to pay attention or control their behavior. According to ADHD Association of the Philippines, estimated 3 to 5% of 0 to 14 years old in the Philippines have this condition. Many of these children might continue the symptoms until adulthood, although hyperactivity might reduce with age. The causes of ADHD. ADHD's causes is still unknown, but many researchers, psychiatrists, and psychologists suggested that this condition is about neurobiological basis. Some parts of the brain is smaller with children with ADHD. It also shows that there is a problem with the chemicals in the brain that pass the messages. In some cases, lack of early attachment of children to the parents is a great factor in developing this condition. The kids bond to the parents, traumatic events that is related to the relationship and attachment. This might contribute to their hyperactivity or inactivity. Some researchers also propose that ADHD is heredity and runs in the family. Relative of children who have ADHD is more likely to have this condition than the general population. What ADHD looks like. Normal behavior and ADHD is difficult to differentiate. Sometimes symptoms of this condition is mistakenly as normal response from emotional and disciplinary problems. Here are the primary signs of ADHD. The predominantly inattentive or fails to give close attention to details or makes careless mistakes. Has difficulty sustaining attention and organization. Does not appear to listen. Struggles to follow through on instruction and easily distracted. Avoids or dislikes tasks requiring sustained mental effort. Next is hyperactivity. It has a difficulty remaining seated, runs about or climbs excessively. Difficulty engaging in activities quietly, acts as if driven by a motor, talks excessively. The last is impulsivity. Blurs or answer before questions have been completed. Difficulty waiting or taking turns. Interrupts or introduce upon others.
Now that we are done about defining what is ADHD, let's move on to the diagnosis of it. If you are concerned about your child, see a GP. GP are the one who can refer your child to a doctor who specializes in child and youth health. It may be a pediatrician, a psychologist, a psychiatrist, or any specialist who can assess your child. There is no test or specific test for ADHD. A specialist can only diagnose ADHD after making a detailed assessment by collecting a range of information about the child's behavior. It may come from parents, caregivers, or teachers or the school management. For ADHD to be diagnosed, the symptoms of ADHD must be obvious in most areas of child's life. The assessment can include a history of child's behavior, any trauma or illness they have experienced, or it may come from the relationship from parents or the people around them. Doctors and psychologists use a variety of tools, scales, and criteria when diagnosing ADHD. Now let's answer this question. Does ADHD can be treated or cured? Sadly, the answer is no. ADHD can be cured, prevented, or treated, but there are some drugs or treatments that can help the child or adult to manage their symptoms. First is common prescribed drugs. It is divided into three. First is stimulant drugs. These drugs are most commonly prescribed drugs to manage ADHD symptoms. These drugs affect the levels of brain neurotransmitters which improve symptoms of inattention and hyperactivity impulsivity. These drugs are available in short-term, intermediate, and long-acting forms. Side effects are weight loss and appetite loss, sleep problems, and irritability. Second is antidepressant. These drugs are more commonly prescribed to patients with ADHD and mood disorders like depression. These are not as effective as stimulant and non-stimulant drugs in improving ADHD symptoms. Common side effects are sleep problems and increased risk of suicide to young adults. Lastly, non-stimulant drugs. These drugs are prescribed for patients older than 6 years old who can or who do not respond to stimulant drugs. This improves focus and attention and decreases fidgeting of ADHD patient. These drugs are prescribed to lessen inattention and hyperactivity impulsivity symptoms. They are also believed to affect the brain receptors or reduce symptoms of hyperactivity and impulsivity. Side effects are fatigue, dizziness, and dry mouth. It can also affect constipation. Next is the management of ADHD condition. ADHD is managed with medication, therapy, training, and counseling. The available treatments manage the symptoms but do not cure ADHD. Approaches differ for each ADHD patients. Behavior therapy helps the primary caregivers and teachers of ADHD patients in implementing behavior-changing strategies such as the use of timeouts and reward system. Now let me give some examples of other disorders that can be related to ADHD. Example are bipolar disorder, Tourette syndrome, learning disabilities, anxiety, depression, and autism. Now let's move to how parents aid ADHD. First, they stick to a schedule. Second, stay organized. Next, be clear and consistent. Provide healthy diet. Promote exercise and sleep. Encourage and reward. Lastly, they try to be mindfulness and meditation.
Hi, I am Teresa. So now, let's talk about how can we address ADHD. According to Ms. Benaventura, as a member of society, she said that, first and foremost, in every difference of human beings, the primary trait that we must have is respect. Humans are unique in their own way. Some may have special needs and some can live normally. Indeed, those who need special needs to be respected and not to be judged. Ms. Benaventura also said that, as a member of society who is living normally, all we need to do is always understand, respect, and treat them equally. She also said that person with special needs, especially with ADHD, it's not their choice that they have this case, so we must let them feel that they are worth it. So next, according to Mr. Figueroa, as a future educator, he said that he will address ADHD by knowing the history of the case first. He said that ADHD varies with different symptoms. Teachers may not be capable in giving them the medications that they need, but as a teacher, we must fully give our attention to them. Addressing ADHD in school is a hard task before, but now that we are technologically advanced, we can minimize the gap in fostering ADHD in the classroom. He also added that we must promote lively and long-time teaching that will exercise the student and make them use the environment. So additionally, as a part of the interview, we include 3 questions that are commonly asked about ADHD, and we came up with the answers based on our experiences. The first question is, what does an ADHD tantrum looks like? So Miss Rosario, who has a nephew with ADHD, said that a child who has this case gets angry quickly, throws tantrums, and refuses to do things they don't want to do. Next question is, how do you positively discipline a child with ADHD during his tantrum? She said that we need to help the kids figure out what acceptable behaviors and also teach them to be good and calm as often as possibly we can. Last question, how do you manage kids in your family with ADHD to keep calm and behave? So her answer is, show them that you provide safety for them and let them feel loved and that you support them. However, we need to be careful in how we respond to them. Furthermore, in my personal opinion, as a tutor who experienced teaching a kid with ADHD, this is how I responded with the questions. First, children with ADHD tend to be very irritable, especially during a tantrum that sometimes leads to whining, demanding, or yelling. From what I have observed on my tutor who had this tantrum, he seems very angry and annoyed. He yelled and had a furious outburst. He also became aggressive and threw toys while yelling. Second, so how do we positively discipline them? Unfortunately, children with ADHD frequently receive negative feedbacks when they are throwing tantrums. Some people use negative ways of disciplining, like scolding and hitting the kid. But instead of doing these things, we must do the positive discipline. But how? So first, we need to tell them to calm down and let them know that you understand what they're feeling. Next, you explain to them why the behavior they're throwing is not good. That yelling and throwing things is not a good thing to do. Talk to them, but at the same time, show emotional support that will let them feel that you still love them. Lastly, how do I manage my student with ADHD to keep calm or behave? The first thing to do to keep my student with ADHD calm and behave is to give him positive and enough attention. They tend to ask a lot of questions and a lot of stories to tell. So you need to listen and give your attention to them. But giving attention to their negative behaviors will let them continue these behaviors, so avoiding these mild behaviors is fine. Next, to prevent misunderstanding that will cause tantrums, giving clear instructions is a must for him to understand well what he must do. Lastly, whenever he behaves, I give him rewards to encourage him always to behave, knowing that he will get a reward every time he's behaved.
That's all for this video. I hope you learned from us. Thank you for watching!